Abdominal aortic aneurysm. An abdominal aortic aneurysm or AAA occurs when an area of the aorta becomes enlarged or balloons out when compared to the aorta's normal diameter. The aorta is the main blood vessel which emerges from the heart and supplies blood to the abdomen, pelvis, and legs. Causes and risk factors. The exact cause of an aneurysm is unknown. However, an aneurysm occurs due to weakness in the artery's wall. An abdominal aortic aneurysm, AAA, is undoubtedly a potentially life-threatening condition. Some factors that can increase the risk of having this problem include smoking, high blood pressure, male gender, genetic diseases such as Marfan syndrome, atherosclerosis, hardening of the arteries, occurs when fat and other substances build up on the blood vessel lining. Infection of the aorta. Traumatic injuries cause tears in the artery wall. Cardiovascular disease and other conditions, including vasculitis. Peripheral artery disease. An abdominal aortic aneurysm is often seen in males who are older than 60 years and have one or more risk factors. It should be emphasized that the larger the aneurysm, the more likely it will break open or tear or rupture. Symptoms. Aneurysms can develop slowly over many years, often with no symptoms. Often, the symptoms may come on quickly if the aneurysm rapidly expands, tears open, or leaks blood within the wall of the vessel. Aortic dissection. Meanwhile, some people may feel a pulsing sensation in the tummy, like a heartbeat, tummy pain, lower back or leg pain that lasts for a very long time. A ruptured AAA can cause sudden, severe pain in the tummy, legs, or lower back, dizziness, sweaty, pale, and clammy skin, low blood pressure, a fast heartbeat, shortness of breath, passing out, nausea and vomiting. Exams and tests. The healthcare provider will examine the abdomen and feel the pulses at the legs. The provider may find pulsating sensation in the abdomen, a lump or mass in the abdomen, stiff or rigid abdomen. The healthcare providers may utilize imagery including ultrasound of the abdomen is an excellent diagnostic image when the abdominal aneurysm is first suspected. CT scan of the abdomen will be used to confirm the size of the aneurysm. CTA, computed tomographic angiogram, will help with surgical planning to see the exact location, size, and severity of the aneurysm. Often, the healthcare provider may order an ultrasound of the abdomen to screen for an aneurysm, especially in most men between the ages of 65 to 75 who have smoked during their life. Also, some men between the ages of 65 to 75 who have never smoked during their life may need this test one time. Treatment. The main goal of the treatment and management of an aneurysm is to keep the aneurysm from growing and identify if there is a high risk of rupture, as no known medication can reduce an aneurysm once it's formed. Treatment of aneurysm depends on several factors. If the aneurysm is ruptured, you will need surgical intervention right away. Treatment of AAA depends on the size of the aneurysm. Generally, aneurysms that are less than 5 cm in diameter have a low risk of rupturing and this may not need treatment right away, so watchful waiting will be recommended, which includes getting ultrasounds every few months to ensure the aneurysm isn't getting bigger significantly. The provider may want to check the size of the aneurysm with ultrasound tests every 6 months. If the aneurysm is small and there are no symptoms, then surgery is rarely done, and the provider must decide if the risk of having surgery is smaller than the risk of bleeding if you do not have surgery. Regular exercise, not smoking, eating a healthy diet, avoiding alcohol, and maintaining a healthy weight. Taking medication to lower blood pressure. Aneurysms that are larger than 5 cm across or show signs of rupturing need surgery depending on the size, location, and complexity of the aneurysm. It can either be open surgery or endovascular aneurysm repair surgery. Open surgery. This is done by incising the belly to gain access to the abdominal aorta. Then a graft tube made of a strong, synthetic material is sewn onto the bulging section of the aorta. The graft reinforces the aneurysm to prevent a rupture. After open surgery, most patients stay in the hospital between 4 and 10 days. It can take several months to recover. Endovascular aneurysm repair, EVAR, is a minimally invasive surgery where a small incision is made in the groin and inserts a catheter, thin, flexible tube, into an artery. With X-ray guidance, they thread the catheter up to the location of the aneurysm. The catheter contains an expandable stent that opens inside the aorta to reinforce the aneurysm and prevent a rupture. After EVAR, most patients stay in the hospital for about 3 days. Recovery is shorter than that of open surgery. After either type of aneurysm repair, you must continue to follow up with the surveillance of your repaired aorta, and this can be done with ultrasound or CT. The risks of surgery include bleeding, infection, pain, and reaction to anesthesia. Outlook. Prognosis. A ruptured or torn abdominal aortic aneurysm is a medical emergency. The outcome is often good if surgery to repair the aneurysm has been completed early. Only about 1 in 5 people survive a ruptured abdominal aneurysm. Prevention. To reduce the risk of aneurysms, eat a heart-healthy diet, exercise, stop smoking, if you smoke, and reduce stress. If you have high blood pressure or diabetes, take your medicines as the provider has told you. People over age 65 who have ever smoked should have a screening ultrasound done once. Dr. MKO Abimbola holds a doctoral degree in Physician Associate Studies. He is affiliated with North Texas Mall Medical Center and Parkland Hospital, Texas, United States. He specializes in general medicine, surgery, psychiatry, and geriatrics.